Enter the station and wash your hands with alcohol gel. Introduce yourself to the patient, explain your role, what you're about to do, and ask for their consent. Note that it's important to have a chaperone present in the room for an intimate exam. However, some patients do refuse the presence of a chaperone, and it's important to document such. Comment on the following: how the patient looks generally, their position on the bed, exposure, obvious masses, and bedside equipment. Before moving on, check the patient's vital signs and offer to perform a cardio, respiratory, and short abdominal exam. On close inspection, comment on the appearance of the vulva, hair distribution, skin lesions, protruding masses, scars, prolapse, and discharge. Open a prep jar and double-check the patient's name. Explain that you will be inserting the speculum and that they should expect to feel a bit of pressure. Ideally, add lubricant to the speculum. Part the labia with the fingers of your left hand and insert the speculum sideways first. Once halfway through, rotate the handle 90 degrees upwards and slowly open. Comment on the following: external cervical os, cervical erosions, masses, ulcers, abnormal discharge or blood. Place the cervical brush at the cervical os and rotate it 3 to 5 times and place it in the prep jar. Remove the speculum without closing it fully, whilst it's still in the vagina. This is to prevent pinching of the vaginal tissue. The bimanual exam is used to assess the cervix and fornices for mobility and presence of lumps. Firstly, lubricate the gloved index and middle fingers on your dominant hand. Part the labia with fingers of your left hand and gently insert your index finger of your right hand followed by your middle finger into the vagina. Palpate the vaginal wall for any irregularities or masses. Assess the following when examining the cervix: position, consistency, opening of cervical os, and cervical excitation. In order to assess for cervical excitation, place the cervix in between your two fingers and move the cervix side to side. An excitable cervix can cause extreme pain. Palpate the fornices on either side of the cervix for any masses as such. Assess the uterus in respect to its size, shape, position, surface characteristics, and tenderness. Thank the patient, remove gloves, and examine for any blood or a discharge, and help the patient redress.